So before I enter the room, I'm going to check my physician orders and I am going to make sure that I have all my equipment. Then once I enter, I'm going to introduce myself. I'm going to tell them my name's Chloe, I'm a nursing student, I'm here to give you an IV, and then I'm going to give them the reason due to physician orders. And then I'm going to perform my hand hygiene. I'm going to check my patient identifiers by asking them for their name and date of birth. And then I'm also going to check for any allergies that they have. Then I'm going to make sure that my patient is in a comfortable position. I'm going to identify my site. I'm looking for a vein that is straight. I'm probably going to be on their non-dominant hand. So this one right here looks good. So I'm ready to start. I'm going to put my gloves to the side, open up all my equipment. I'm going to place my tourniquet 15 to 20 centimeters above my site. Then I am going to put on my clean gloves. Then once I have my gloves on, I'm going to take out my ChloraPrep. I'm going to crack the sides and clean for 30 seconds. Then while that's drying, I'm going to make sure the rest of my equipment is ready. So I'm going to prepare my tape. And then I'm going to make sure that my tubing is flush. I have my Tachoderm ready. Everything like that. Then I'm going to have my needle out. Make sure my bevel is up. Then I'm going to pull down and insert my catheter or my needle at a 15 to 30 degree angle. Once I get flashback, I'm going to lower it, advance my needle a little bit more, and then push my catheter all the way up and engage the safety lock. I'm going to occlude the vein, remove my tourniquet, and then apply my tubing, which has been saline flushed and sterilized. Once that's like that, I can take my IV and take my saline lock. Then once that's done, I'm going to apply my Tachoderm on top. I'm going to make sure that it's labeled with the date, the time, the type, and the gauge, as well as with my initials. Then whenever I'm ready to remove my IV, I'm going to take my gauze. I'm going to remove the tape, hold pressure. I'm going to remove. And as I'm pulling, I'm going to start applying pressure once the catheter is out, and then tape over that. And then I'm going to make sure that I'm documenting everything appropriately.